nosebleed, as simple as it appears, could sometimes be quite dangerous. There are two different types of nosebleed. The first one can happen at the front part of the nose, which could be as a result of a damage to the septum, that is the line between the two parts of the nose, and it could be as a sort of dryness, or as a sort of there's this thing called mucosa, which keep the nose wet. So if that's have been eroded and the nose is now dry, so those little blood vessels, capillaries could break, and it could result into bleeding. You know, it could be as a sort of trauma as well. A punch to the nose, or heavy objects, or even when someone blows the nose and blows the nose too hard, that could result in nose bleeding. So those old type of bleeding happened at the anterior end, that is at the front. So those are not dangerous. So the second part of nose bleeding is posterior nose bleeding. That is the one that happened at the back, at the back of the nose, so connecting to the throat. And that could be dangerous, and that could be as a result of breakage of bigger blood vessels, so that are bigger than the one that happened at the front. So expectedly, there'll be more blood coming out, that kind of situation. And this could be as a result of different things entirely. It could be as a result of disease, liver disease, kidney disease. Even though chronic abuse of alcohol, that can be as a result of that. And the best way to deal with that, even though any nosebleed at all. So when we are bleeding in the nose, the first thing to do is to pinch that nose. You pinch your nose, in a way, and when you pinch your nose, and that sort of constrict the vessels around the nose from releasing more blood. One other thing that you need to do, these are home remedies, apart from seeking the medical help immediately. You tilt your head forward, you tilt your head forward, and allows whatever is coming out of the nose to drop on the floor, rather than going back inside, which can result into gangling and inhaling. You don't want to get choked by your own blood. And again, you start to sit upright, like the way I'm sitting now. When you sit that way, your nose is elevated more than your heart. So that will reduce blood pressure, because it's more difficult for blood to climb up than to flow when you're lying down. So when you are having a nosebleed, just sit upright, and that will restrict the blood vessels and everything from pumping more blood. Okay, avoid lying down. That's what we are saying. And again, you can use ice pack. When you use ice pack on this nose, you just place the ice block or ice pack on it. So that's reduce, that help to constrict the blood vessels as well. It will not stop the bleeding on its own, but it will stop the flow of the blood. So when you're using some medications, creams and everything that you apply to your nose topically, this can also encourage a nosebleed. If you are taking some medications that are blood thinner, some medications that help your blood to thin, maybe due to certain conditions, like warfarin, like aspirin, non-steroidal anti-inflammatory like aspirin, then clopidogrel, which is medication used to treat a heart condition. They can interfere with blood clotting and stop your blood from clotting immediately. And again, if you have a special condition, inherited condition whereby you got problem, your lineage, father, mother, or in your family got problem with blood clotting, that could be inherited. Then the platelet disorder. Platelets are the blood component of blood that is responsible for blood clots in the body. If you got platelet disorder, you also have problem with blood clotting. Whatever happen, in particular, what happen at the end of the day, if you have issues with nose bleeding and it's not stopping on time, please seek medical help. Call for help. Do not self-diagnose. Do not self-treat. Do not take it easy and just okay, to go by itself. Seek help. Then you continue to apply the remedy as you are going. So that could be the difference between life and death. It could be a bigger or more serious situation or more serious condition than you thought. Thank you so much. That is what I can say about nose bleeding. Nose bleeding is a very wide topic, but you can just only keep it to certain time so that it don't appear boring. Thank you. God bless. Bye.